This is the death of rural communities. I have patients that I've seen since they were young children, young boy and girl, who I recently was not able to see anymore because the family's insurance changed to a closed network, and I'm outside of that network. And so now this family that lives 30 miles away from the next in-network provider has to make that type of trip back and forth to take care of their kids. It's a death to our community, and that's income, that's money that comes out of our community now. Our pharmacy suffers when incentives from insurance companies to move prescriptions to mail-in pharmacies takes that prescription out of the local pharmacy. It takes traffic out of the local pharmacy because of that, and our community starts to die. Critical access hospitals, where we start to limit the availability of providers, where we now don't have OBGYN services or labor and delivery services in rural communities. Who would move there? So I speak on behalf of the death of rural America and ask where this is being addressed at the federal legislative level.
I'm starting to address this issue because I agree with you. Nobody's doing what we need to do to take it on, so I'm going to take it on. I've already written multiple rural health care bills, certainly to address physician shortages, absolutely to close reimbursement gap rates for rural health care clinics. As you're aware, dependent on how they are structured, if they're not owned by a hospital, they don't get covered for all of their expenses. So we've got rural health care clinics falling by the wayside just because they're not owned by a hospital. I'm also working on a bill to help us address rural health care across this country and ensure that we don't close down more hospitals. As you know, we've closed down critical access hospitals in rural Iowa and across rural parts of this country. One of the most important things is for people in Congress and those who I work with to understand how we're connected with each other and why it's important to support rural health care. If we lose rural health care, and you implied this, if we lose rural health care, we will see our communities literally die, because there will be no place for folks to go to with the services that they need. That's going to impact our small businesses, our manufacturing communities in so many of these towns. We're going to start seeing a huge impact, and you brought this up, economically across this country. And that is why, another reason why it's so important to address. Not only is it the right thing to do, it's really the smart thing to do for us to be successful as a country. There's no reason that we should be leaving rural America behind, and I'm going to make sure that that doesn't happen.